There's a quote, I think, in the case report where he says that he'd rather eat ground beef for the rest of his life than go back into the mental health system.
It's incredible to see, but there's another published case report of an individual transforming his life and putting his mental illness into remission with ketogenic therapy. But what makes this one kind of stand out is this individual was in and out of homelessness. He had a tremendous socioeconomic challenge. And we often think that a ketogenic diet is really expensive and hard to do. Well, here's an individual who was living in a hotel with a hot plate or a microwave, or, living in a shelter, and was still able to achieve sustained ketosis and put schizophrenia and psychosis into remission despite those circumstances. Such a dramatic example. So I'm joined by Moira Newiss, who's a registered nutritional therapist and health coach who had the opportunity to meet this individual and work with him and took the step to publish his case report. Now, it's correct to say, oh, this is one case report, this is not a study, but that's not the point. The point is this was an individual who was deeply embedded in psychiatric care in the UK and was taking his medications and was seeing his doctor and was in and out of the hospital and wasn't getting better. And it wasn't until he was in sustained ketosis that he was really able to achieve treatment success and eventual remission of his psychosis. So a dramatic case report that I think tells us a lot about what is possible with ketogenic therapy. So I hope you enjoyed this interview with Moira Newiss. Hi, Moira. Thanks so much for joining me at Metabolic Mind.
Yeah, it's a pleasure to be here. Thank you for inviting me.
Yeah, of course. As soon as I read the case report that you published, I just wanted to reach out right away and really understand more about this case, which is so dramatic, about a person who is homeless and in and out of the hospital and very challenging socioeconomic circumstances, but somehow was able to really thrive on a carnivore-based ketogenic diet and go and put his schizophrenia into remission. Like, all these grand things happened with challenges. And so I'm so excited to talk to you about it. But, before we get into the details, tell us a little bit more about you. How did you get into this field of ketogenic therapy and ketogenic diets to help people change their lives?
So my own story is that I was a senior manager in the NHS, the UK Health Service, for 20 years. I burnt out, but ended up with 4 different mental health conditions myself. Tried to get better, quit my job as part of that process, and along the way discovered nutrition, and then decided to retrain in nutrition. I wasn't 100% better at the time. I was getting towards the 70-80%, and I discovered ketogenic diets in the first year of my 3-year nutrition diploma and got fascinated by ketones and mitochondria and the whole metabolic health aspect of things, and basically did a ketogenic diet myself for 3 months as a trial, and I've never come off it really. I've pretty much been constantly on it for 6 years and never had a remission of any of my symptoms really, for not any kind of significant relapse at all.
Yeah, so it's a story we hear, and I never know whether to say fortunately or unfortunately that you discovered this on your own, and it wasn't recommended by a doctor. It wasn't recommended by a dietitian or a therapist or a coach, or you had to find it on your own. And that's what we're really trying to break down, that barrier, because so many people have found their way to health through ketogenic therapy on their own. And we want it to be so much more widespread. But interestingly, that sort of plays into this case study too that you reported. So first, give us the background. How did you meet this individual, and give us the background of this individual?
So he had had difficult socioeconomic circumstances, had become homeless at various times, was hospitalized at times. But during one of the spells when he was homeless, he read a book called Tools of the Titans by Tim Ferriss, which is really a book to help you improve your life. It's not really a nutrition book.
And it's a huge book. It's like super thick.
Yeah, it's a big book. And one of the things that he was recommending in there as something that might help improve your life was a 3-day fast started on the Thursday evening with a low carb meal, followed by 3 days of fasting. And it was to get ketones produced. That was the point of it. And I believe that, I haven't read the book fully myself, I have to admit, but I believe Dominic Agostino was involved in writing part of that. And you will know who he is, I'm sure, but he was researching human and machine cognition. So this was all about, trying to improve not just your mind, it was your life, really. And so that's what he came across and decided to try that, because actually fasting is quite easy to do in difficult socioeconomic circumstances for a start. So he was, that was really what started the process, I think. And he was, and then from there on, he just learnt more and more. And by the time he got to me, he already knew about you guys. He knew about people like, George Eade, Chris Palmer and the Brain Energy book and things like that. So by the point it got to me, he'd actually been trying to implement a ketogenic diet himself, but was having difficulties. He wasn't able to get stable, high enough ketones and stable blood glucose at that point in time.
Yeah, and the underlying problem here, or not, one of the underlying challenges he had was was diagnosed with psychosis and schizophrenia, right? So he'd been in and out of inpatient treatment. He'd been on multiple medications. So give us a little bit about his psychiatric diagnosis background.
Yeah, absolutely. So he had that diagnosis. He also, was suffering a bit of anxiety and worry about things. And he was struggling with day-to-day life at times just because of the circumstances he was in. If you're homeless, you need housing, you're out of work, so money's a problem. So there were several other factors involved in this particular case. And he'd been in and out of acute hospital care for his mental illness on several occasions over the previous 3 years, and he'd been under the care of a psychiatric team for all that period of time, and still was when he came to me. So he had been recently deemed more stable and had been in a rehabilitation inpatient setting still, but that was where he actually began to restart his diet. At that point in time, he hadn't been able to do it. He tried things like longer fasting to try and keep his ketones up whilst in hospital. That's how serious he was about trying to do it. But of course, you can't sustain that. It's impossible to carry on fasting. And every time he went back to eating standard NHS food, it was problematic for him. So he was in this kind of boom and bust cycle all the time. But at the point where he got into the rehab, he was able to cook for himself. So that was the start of him trying to get his ketogenic diet established on a more regular basis at that point. And then he was discharged.
Yeah, so back to the point where he was trying to do his longer fast to get his ketones up. Like, did he tell you like it was clear cut when my ketones were up, I felt better, I felt clear? Like, what did he notice, or was it maybe less dramatic in the beginning?
I think it was there was a definite, I don't think he necessarily was measuring right at the beginning, so he didn't really know what his ketone levels were. So we're not entirely sure how well into ketosis he was, to be honest. But he was reporting that at those points in time, he would notice a massive difference when he went back onto the carbohydrates. So that's probably the most significant difference. And he was, because he'd been reading various books that said you could do this, for 3 days, and then you could have cheat days and things like this. So he was having actually quite a lot of high carbohydrate food in between doing the ketone. So I don't think he saw any significant benefit for any periods of time because he wasn't really doing it for long enough.
Yeah, that makes a lot of sense. And, the other point this brings up, though, is that what is a treatment success? And, for a busy psychiatrist who's got a lot of patients, goal number one is, are they a threat to themselves or are they a threat to others? And if they're not, then that can be deemed a treatment success. But I think if you ask this individual, is that a treatment success? He probably would have said no. I mean, because not really, doesn't have a job, doesn't have a home, isn't well enough to be able to sort of participate in a society the way, he probably would want to. So it's interesting about that different definition of treatment success. So I know you work with a lot of clients. I'm curious, do you find sort of a big discrepancy about what is the definition of treatment success between what your clients think and sort of what the medical system as a whole thinks?
Well, absolutely. And obviously I've seen, the way the NHS works, I've worked in it for 20 years. So I'm very familiar, from both primary care and acute settings. I've worked in those different areas. Mental health is no different really to something like diabetes, which obviously people, in general practice, GPs and people are much more familiar with. And they're beginning to see the difference that they can get with reversal of diabetes, for example. But we're not familiar enough yet with what can happen if you can potentially reverse some of the underlying factors that are driving mental illness, if it's from the metabolic side. So absolutely, I think that for me, both personally and with my clients, success for me means that not only can you kind of get your life back, which is quite significant, normal functioning in society. And that's definitely what this particular client wanted, was to be able to function normally in society. That's not a big ask, if you ask me. That should be a given. And anything on top of that, in a way, becomes a bonus for somebody who's been in this situation, I feel. So he is getting back into volunteering in the mental health service to support other people, and that's a big thing. He's very keen to offer support to other people, and also, I'm sure, to help sell the message about ketogenic diets and the potential benefits of them. But for somebody like this particular client, he obviously needs to get housing. Income's an issue. There's a lot of other things that need to be sorted, that perhaps for most clients who are coming to somebody like me, they're not perhaps in such a difficult situation. They're probably better off financially a lot of the time, otherwise they wouldn't be coming to me in the first place. So their definition of success might be slightly different. It might be about getting back to a job that pays well. It might be about being able to engage in lots of different kind of social activities. I guess so everybody's definition might be a little bit different, I think. But I think certainly if you've got to rock bottom, then actually getting back to normal functioning, it is success in itself, I would say, as well.
Yeah, and I really like that point, that everybody's going to have their own definition of success. And I think that's something that, we in the medical field as a whole are really sort of lacking, is finding what that definition of success is and working tirelessly to help someone achieve that, as opposed to saying, okay, we've reached sort of the basic definition of success, so good enough, and sort of let it be there. But anyway, that's a little soapbox statement. But tell us more about this individual, because I could see that someone could be like, well, I've tried this fasting, I've tried this keto thing, and it just didn't work for me. With the caveat that he was having cheat days, but maybe in his mind he thought he was doing it and it didn't work, quote unquote. So I could see a lot of people doing that, but no, he sort of persisted. So tell us more about his journey.
Yeah, so somewhere, I'm not entirely sure when, but somewhere along that path, his path, he began to research more about ketogenic diets on his own volition, and he started to read blogs and information that was out there in the public domain. He was watching Metabolic Mind YouTube channels, and he started to gather that information. So I think that gave him the motivation and the impetus to kind of try again. But knowing by that point that it needed to be much more sustained, and it needed to be potentially at a higher level than just getting into ketosis, trying to get to a therapeutic range. So when he came to me, one of his aims actually was to get off medication. Obviously, I'm not a prescriber, so I don't do that. I have to liaise with his team. But yes, I think by that point, he was very much in ketosis when he came to me. It just wasn't stable. So he'd already got himself to the point of kind of knowing roughly what he should be eating, but it needed to be tweaked, to make it. I was aiming to get him up to a 2-to-1 ratio to kind of get him into a therapeutic state of continual ketosis above 2 millimoles, within that kind of range. And actually, because he was knowledgeable already, it was actually very easy to do. So very, very quickly, he got into that range and pretty much stuck to it most of the time. We had 1 or 2 little ups and downs at the beginnings. One of the reasons was that he was fasting quite a lot still, and we had to kind of get that in check because his ketones were going a bit high at times. But pretty much with a pretty basic diet, he didn't eat a lot of different ranges of food. It was pretty, pretty simple to prepare.
Yeah. So tell us about the foods, because, we see these videos of, your grass-fed ribeyes and your, maybe your organic low carb veggies and your pasture-raised eggs, right? And like, sure, that's a wonderful way to eat, but when you don't have a job and you don't even have a home, there's no way you're going to eat like that. So what were some of the food choices that he was able to use to maintain ketosis?
So when he first came out of hospital, he was staying at a family member's house, and so he had a bit more variety of food available to him. So he was eating things like ribeye, avocado, so kind of more things that we, used to talk about. But when he became homeless again, he had very restricted finances. So he basically reverted to eating what I would call 25% fat ground beef mince. I think in the US it's the other way around. So you say 75% lean or something. I'm not sure, but high fat mince, which with added beef tallow. So, in the UK, if you buy 500 grams of 25% fat mince, that costs you around £3 a day, which is, I think, about $5.5 US, plus, maybe £1 worth of beef tallow. So you're looking at a day's worth of food costing around £4 or $5.5 US. So, that's £28 a week or around $38 US a week. So it's affordable, and it worked, and he was able to do that with only very basic utensils. So a microwave, and a spoon would do the job effectively. Whilst staying at one point, he was in a hotel room, which was what he was provided with as a homeless person. It was one single room with a microwave in it. So, it's amazing really that he stuck to that, and, there's a quote, I think, in the case report where he says, that he'd rather eat ground beef for the rest of his life than go back into the mental health system.
Yeah, and I think about that quote that someone who is well has 1,000 wishes and 1,000 dreams, and someone who is not well has one wish and one dream, and to be well again. So someone could look at that and be like, oh, I can't eat mince for the rest of my life as the only food. How boring is that? As opposed to his perspective, I don't want to be in the hospital again. I don't want to experience psychosis again. I can eat mince for the rest of my life. A really different perspective, and I think a pretty powerful one as well. But you mentioned the fasting, which I think is really interesting. So in the beginning, he was using long fasts to sort of help get into ketosis. But now that he was in ketosis nutritionally, you're saying some of his longer fasts may have been hurting him or counteracting some of the benefits. So tell us about that.
Yeah, so he was getting ketones, up to 7-8 millimoles, even higher at times, which I felt were too high really, and that we were risking problems there. So, and I think that was to do with a combination of things, but including the longer fasts. And that was fairly easily addressed, to be honest. And the strategy we came to was eating 2 meals a day. Which also keeps things very simple when you're in that kind of situation. 3 meals gets more complicated again, to keep things very simple. So we're still having, periods of time where he wasn't eating, and, extended overnight fast as part of that. So the intermittent fasting is a good strategy, actually, to fit in with a ketogenic diet in these kind of circumstances. It adds a bit of extra flexibility to the situation, I would say. It just seemed to work well, really, in this setting.
Yeah, and interesting to see where someone can find their sweet spot for, making sure they're getting adequate calories, adequate nutrition, adequate protein, getting enough fat, and then, how that affects not only their mental health, but their overall metabolic health and their overall energy, right? All these things are intertwined, and sometimes the concept of fasting can go too far to sort of prevent that. So now there was also some substance use, which is unfortunately very common in the mental health field. And so he was using cannabis on and off, it sounds like. And we've heard things about, ketosis maybe improving addiction, certainly for alcohol. Maybe it can cross over to cannabis. So how did the cannabis use, interplay and affect his mental state and his ability to function independently?
Yeah, so I think actually the cannabis possibly contributed to the higher ketones with the fasting as well, just to put that point in there, because there is some literature suggesting that could be the case, but very limited, because I did try and research and there's very limited research. So, that was also an impetus to try and draw back on the cannabis. But I think, in those circumstances, sometimes it's a coping strategy. And people have to tackle one thing at a time sometimes. But he has been able to reduce that input. It was also, it's also been, a strategy that's helped to keep his stability in his life a bit more by managing that. So he was aware of that, but he was also, at the point that I came to know him, it was a coping strategy, that was for sure. So I can't really say a lot more about that, unfortunately, Bret. There's not much more I know about that side of it, to be honest.
No, but it's a really good point, right? So ketosis can help a lot of things, can impact a lot of things. But like you're saying, the coping strategy, so he would need a substitute, right? It would be hard to just stop cannabis if you really feel that helps you cope and helps you in so many ways. You need a replacement, right? So a lot of people say, well, eating a ketogenic diet isn't going to fix everything. And that could be absolutely right? You still may need therapy. You still may need other behavioral changes. There are still a lot of things that may need to fall into place, but certainly for him, he had no chance of addressing any of those when he's in and out of the hospital and in and out of psychosis. So you kind of absolutely have to stabilize that part first before he can then address the other parts of his lives. I know Nicole Arant always says, like, she's noticed people can do so much better and deeper, more productive work in therapy when they're in ketosis as opposed to, before. So I'm curious how you work with your clients on that. If you have to help them with behavioral changes and how you see the ease of that happen when they're in or out of ketosis, and how they're doing mentally.
Yeah. So I think often I would totally agree with Nicole. It's a lot easier quite often to get other behavioral changes in place, other lifestyle changes in place. When people are in ketosis. Sometimes also, if you just take something like exercise as an example, often some weight loss helps as well. People get more mobile and that kind of thing. So there are other benefits that kind of come into play at the same time. But I would say that I always start with a ketogenic diet. So I probably don't often do it the other way around. So I'm speaking from a slightly biased perspective on this, but I would always start with nutrition and the ketogenic diet before I try and get other things into play, because usually you can get people into ketosis quite quickly, and then other things have become easier to do, because if people have more energy, if the brain fog's clearing, if they've got less pain, if their mood is more stable, all these things are better. It's much easier to make other lifestyle changes, whether it's going to the gym or exercising, or whether it's, tackling difficult relationships, or, just trying to get outside more. All these other things that I would be encouraging people to do, it just get easier. I would totally agree with that.
Yeah. Well, now I'm curious about some of the response that you've had to publishing this case report. I saw it was included in something in Washington State and in like a journal that they did, or, and some people could say, it's just one case report, it doesn't tell us much. And other could say, wow, this is so dramatic with this person's circumstances, how this helped. Do you have a feel for sort of what the response has been?
It's been generally positive. The review process was a little bit interesting when I did the publication, because I did, there were some questions that came up during that about, is this a healthy diet, and concerns about fat intake and this kind of thing, but overall I've actually had a positive response. Very interesting, within my own profession, there's been a hugely positive response. So I'm one of the first nutritional therapists to publish a case that is using a carnivore diet as well, and a ketogenic diet. So yeah, absolutely. There's a lot of interest there. I've just actually recently presented at my profession's annual conference on using ketogenic diets for brain health. There was a really interesting uptake and discussion around all of that, really. So I think there's growing interest in professional ranks as well, as from, people who want to do it themselves, which is great to see, really. So I've had positive response. Once or twice on social media, might have had the odd comment that's been questioning a bit more about things. I had one just the other day from somebody saying, well, is this something that you should be recommending from a nutrient perspective? And my answer is, well, there's no evidence to suggest a ketogenic diet can't be well managed from a nutrient perspective. Maybe the carnivore side is a little bit more controversial, but there are certain foods that you want to add in, ideally in that scenario, to just broaden out the eating as much of the animal as possible. So this particular case report, when he was just eating ground beef with tallow, I would say that could be more ideal. There might be other things that you could consider adding in, but actually we also know anecdotally from other people that many people actually do quite well just eating meat and fat, and who have done it for many, many years. So I suspect part of the difficulty is we don't really have very much research on this. And when we do set nutrient targets for the population to consume, they are based on certain populations, and they're not we don't do testing on people who eat a carnivore ketogenic diet and then set a nutrient intake reference rate for them, do we? So I think that's part of the problem. And if you just take something like vitamin C, for example, fresh meat's been used to prevent scurvy in the past, but you wouldn't think of that as the obvious choice, would you, for providing vitamin C? So there are lots of these kind of debates that haven't really been fully answered, I would suggest, in the nutrition world.
Yeah, you need a tall glass of orange juice, right, for your vitamin C. That's the only way to get it seems like. But it brings up the double standard, right? If this had been a vegan diet, which is clearly nutrient deficient, right? It's like by definition is nutrient deficient and needs to be supplemented. People would just say, "Oh, that's okay. You can supplement it and be fine." But with the carnivore diet, that's not the response. It's not, "Oh, well, you can take supplements and still be okay." But there's this fear against it. But I don't know. I'm not seeing case reports of this type of remission of psychiatric disorders with a vegan diet, with a Mediterranean diet, right? I'm not seeing that. I'm seeing it with a ketogenic diet, with a carnivore diet. So I really think we need to embrace that rather than push against it.
Yeah. And you know what? One thing I always try and explain to my clients is I like to take them back to kind of like ancestral health perspective. What did we do as hunters and gatherers? What were we eating? It was probably mainly fatty meat, with a few tubers, if you could find them in the summer when they had leaves. Those things die off in the winter, in the UK, maybe a few berries in the summer. Plenty of fish and seafood, probably. Eggs, but you only get eggs actually when the birds are nesting. They don't appear all year round like we do now with hen's eggs. So actually, when you start to take people back to like an ancestral diet perspective, most people kind of get that and realize it was more nutrient dense. It was probably, we were probably in ketosis at least, several months of the year. And that's what I believe as well. And there's a lot of anthropologists supporting that view as well. There are mixed views, but, we definitely weren't eating a vegan diet. I don't think there's any tribe in the world that eats a purely vegan diet. And then you've got all the stuff about when we started, moving into agriculture, brain sizes shrank and there were nutrient deficiencies for the first time, really. So, yeah, we could go on forever about that, I think.
Yeah, I mean, the whole anthropological topic opens up a whole can of worms about that, but super interesting to dive into. But I mean, the fact remains, though, that when you're seeing somebody change their lives and transform their life in a way that they have otherwise not been able to, and not for lack of trying, right? This wasn't an individual who was disenfranchised and out of the institution and not getting care. No, quite the opposite. He was deep into the institution, getting care, and still wasn't able to transform his life, but he did it with a meat-based ketogenic diet. I mean, we should all be embracing that, even if we think it's such an unhealthy diet, even that's our bias, we should still be able to sit back and say, wow, this guy transformed his life. Maybe I should think more about this and learn more about this. And that's what I hope this case report really kind of helps people do, to say, maybe I should relook at this when I see how this person has completely transformed his life. So I thank you for publishing it. I thank you for taking the time, because I know it's not easy, and going through the review process with, I'm sure, reviewers who have sort of an anti-keto bias in a way, but you stuck it out and published the case report and really helped this individual change his life. So thank you. And if people wanted to learn more about you, the work you're doing, where can we direct them to go?
Yeah, sure. So my website, which is my name, it's Moira Newiss, which is moiranewiss.co.uk. And I have quite a few interesting blogs on there as well, which might be helpful for people. And yeah, you can reach out to me from there.
Great.
Thank you very much, Bret.
Thank you.